Hello everyone, and this is Team 2's presentation on Rationale for Interprofessional Collaboration in Canada. Interprofessional care is the provision of comprehensive health services to patients by multiple health caregivers who work collaboratively to deliver quality care within and across settings, and this was stated by Health Force Ontario. So the learning outcomes for our presentation are as follows. To clearly define the term interprofessional collaboration, or IPC, as it pertains to healthcare in Canada, to discuss different approaches to IPC care in Canada, to briefly discuss the beginnings of IPC care, to discuss the advantages of IPC for patients and professionals, and to effectively educate future healthcare professionals by rationalizing the reasons for why we have IPC in Canada. So what is the reason for IPC? Canada needs a new healthcare model because our current model of healthcare delivery cannot be sustained. Canada's health system is strained. The strain is felt by healthcare workers and their patients. The cause of these strains can be, but are not limited to, the rise of chronic diseases such as diabetes, heart disease, and mental illness. Patients and their families expect efficient and timely care, and patients are also becoming more active knowledge seekers in their care plans. It is important to preserve the healthcare workforce we have now. What is IPC based upon? Well, IPC is evidence-based healthcare. So, settings may increase access to healthcare, improve results for people with chronic diseases, improve interprofessional relationships and the use of clinical resources, and increase job recruitment and job satisfaction. Interprofessional collaboration proves to be beneficial for both patient and healthcare providers. Studies have shown that healthcare professionals that work in an interprofessional collaborative environment have higher job satisfaction ratings when compared to work settings in which there is a single practitioner providing care. Professionals working collaboratively are able to enhance and further develop their knowledge and skill and can also offer a wider range of services. By working as a team, the responsibility is shared amongst individuals, therefore reducing employee burnout. There are many positive outcomes that occur as a result of this. These include shorter wait times, more comprehensive and coordinated care, and easier access to services. Patients are more satisfied with their healthcare experiences as they feel more educated about their conditions and self-treatment methods. Overall, interprofessional collaboration provides a potential for more successful health outcomes in patient care. Interprofessional collaboration is not a new concept, as IPC has been in practice in different areas of healthcare, such as long-term care homes where a group of differing healthcare disciplines care for a community of patients. What is evolving is the newer concept of IPC in primary healthcare. Although IPC is promoted and the fundamentals of communication and collaboration are being taught in education curriculums, for example, dental hygiene students at George Brown and fellow RN students co-educate one another during organized clinic times, interprofessional collaboration is encouraged in school, but not always easily facilitated in practice. There is a need to close the gap of lessons taught in school and current practice expectations regarding IPC and IPE. The main body responsible for promoting IPC in Canada is the Enhancing Interdisciplinary Collaboration in Primary Healthcare in Canada initiative. This initiative is funded by Health Canada's Primary Healthcare Transition Fund. It is led by a steering committee of 10 national healthcare associations, including Canadian associations such as occupational therapists, social workers, speech-language pathologists and audiologists, nurses, pharmacists, physiotherapy, dietitians, psychological association, medical association, and the College of Family Physicians of Canada. The initiative is designed to provide literature on interdisciplinary collaboration of primary healthcare in Canada, examine policies, examine the individual's responsibilities of providers, and develop recommendations. In order to understand how interprofessional collaboration between healthcare workers has become an important part of Canadian healthcare, it's useful to know how the Canadian healthcare system was created. In 1867, the federal government created the Constitution Act. This act gave jurisdiction to the provincial governments over the hospitals, including marine hospitals and quarantine. The provinces were thus made responsible for the delivery of medical services, education of physicians, and various other healthcare services. The government was given the ability to tax and borrow money from the public, as long as the taxation did not hinder other provincial ventures. Healthcare was a part of the Department of Agriculture, until the Department of Healthcare was developed in 1919, taking over the responsibilities surrounding healthcare. However, most healthcare services were privately delivered and funded, leading to very little collaboration since the services were individually sought out. At the start of World War II, the Canadian economy began to recover from the Great Depression of the 1930s, due to the creation of job opportunities brought forth from the needs sparked by the war and its outcomes. Average citizens were employed, and the economy was booming, meaning that higher incomes were available, allowing people to pay for better health care from the private services. However, this private form of healthcare caused a tier effect, where some people receive great care, others may not be able to receive any care at all. However, the war and the incoming injured and ill soldiers influenced the government to start thinking about implementing health insurance and improved policies. The quote that defined the government's state of mind at the time is when the president of the Winnipeg Medical Society stated, "The socialization of medicine is coming as surely as tomorrow's dawn. It is the natural result of public demand for adequate, complete medical services." 1942. After the war in 1947, Saskatchewan took the initiative to improve and implement a provincial universal healthcare plan for all residents of the province. This universal plan was approved only 3 years later in BC and Alberta as well. In 1957, the Hospital Insurance and Diagnostic Services Act was created, stating that reimbursement and cost sharing for specific hospital and diagnostic services would be provided. This led to the implementation of public funding for certain necessary healthcare services across the country. The Canada Health Act was founded in 1984, which declared the federal government's goal to implement criteria regarding improvement in accessibility, universality, portability, comprehensiveness, and public administration revolving around healthcare services. The World Health Organization wrote up a document in 1981 called the Global Strategy for Health for All by the year 2000, which they hope would coordinate collaboration between healthcare professionals internationally. This document asks for further collaboration between the various health services and institutions following agreement on allocation of responsibilities in order to make the most efficient use of resources. These may include services and institutions belonging to government, private sector, social security, and non-government and voluntary organizations active in the health sector. This collaboration was to be used at various levels in the healthcare system following agreements regarding the sharing and allocation of resources, labor, and functions. Healthcare teams and collaboration among professionals has been around for many years, as it was necessary, however, as the healthcare system and procedures become more complex and more professionals with varying education are involved in patient care. It is vital that the healthcare team effectively organize and deliver the highest quality of care for the patient. The EICP initiative's principal approaches to interprofessional collaboration include patient engagement, population health approach, excellence in care and services, accessibility, trust and respect, and effective communication. Patient engagement involves the patients participating in decisions and management of their own health so that their concerns are taken into consideration. The population health approach involves working with the members of the community to assess the needs and health problems present. Programs and services are then customized to address the problems present and any determinants that may affect the community. Excellence in care and services are obtained by using current research as a basis for setting standards in the treatment of patients. Excellence in care and services is what drives the need for ICP in healthcare, so that professionals can combine their knowledge and skills to provide the best possible care. We must have accessibility so that patients have access to the right services, provided at the right time, in the right place, and most importantly, by the right health professional. Trust and respect must be present among all healthcare professionals to create an optimal environment for shared decision-making. And lastly, effective communication at interprofessional and organizational levels. Effective communication involves all professionals participating in active listening, information sharing, and decision-making. To achieve successful interprofessional collaboration in practice and realize its full potential, health professionals must acknowledge and accept their central role in the evolution of a team-based approach to care. As members of a collaborative care team, members have a responsibility to be open to contribute and to contributions of all health team members, be knowledgeable of each other's professions and how they can work together. Where one profession ends and another begins is very important to understand. Respect roles and unique contributions of others. Keeping open minds and supporting each other creates success. know common links and skills among the team, value and respect the benefits of collaborative healthcare teams and its members, embrace different perspectives and knowledge of team members. To be successful, no one person is responsible for the success of the team or possesses the skills and knowledge needed to provide all care to an individual patient. Teams share a common goal of caring for the patient. Patients benefit from hearing different opinions and perspectives. By having a team of health professionals work in collaboration on a patient case, the patients are able to make better informed decisions because they can hear from many health providers working together and not just from one, who would normally be their physician. This leads to better decision making on the part of the patient in hearing from members of the health team. By establishing a team or community of care, it allows patients to feel they can have a dialogue with different members, as they are treated differently by each member of the team, and this removes any fear of the unknown for the patient. And as a result of the team and holistic approach, there are improved health outcomes. Interprofessional collaboration has many benefits to healthcare funding and resources. The holistic and collaborative approach to interprofessional collaboration provides improved care and therefore prevents readmissions, saves funds by reducing unnecessary utilization of resources, improves management of patients with chronic conditions and multiple comorbidities, and improves teamwork, which leads to better decision making. The strength offered from interprofessional collaboration shows an improved benefit for patients, healthcare teams, and resource management. First Nations, or Aboriginal people, have been statistically known to have poorer health as compared to other Canadians. High rates of morbidity and mortality among the First Nations people can be attributed to the ineffective system of healthcare service delivery. Early in Canadian history, the goal of First Nations policy was assimilation. The British North America Act, 1867, defined First Nation issues as federal jurisdiction and healthcare issues as provincial jurisdiction. This was the first act to create controversy over who was responsible for looking after the affairs of the First Nations people. The White Paper and the Red Paper proposals were important as they stopped all assimilation policies and allowed for the First Nations people to gain some control over their healthcare programs. The next step in healthcare for the First Nations people were the policies of recognition. The Indian Health Policy stated that to achieve an increased level of health in the First Nations communities, it is important that the First Nations people are a part of maintaining health programs and activities on reserve. The next policy of recognition is the Indian Health Transfer Policy, which now states that any resources for health programs are to be controlled by the First Nation community. This was to happen over a gradual period of time and was supposed to be beneficial for everybody in the community. The Royal Commission on Aboriginal Peoples was the last policy of recognition, and it was important for addressing issues of Aboriginal peoples, including recognition, status, and future prospects. Currently, the federal government has taken on the responsibility of providing First Nations communities with primary healthcare services on reserve. The federal government is also responsible for providing funding to each province for health-related programs, as well as healthcare premiums for individuals who are known to be of First Nations descent. The province, however, is responsible for providing healthcare to those who are not on reserve. This slide represents the two most important medical conditions that plague the First Nations population. In order to increase the level of healthcare support for these conditions, it is important that the interprofessional collaboration is practiced by all healthcare professionals. For diabetes, the First Nations community would benefit from the collaboration of family physicians, dietitians, nurses, diabetes specialists, and rural physicians. Family physicians and nurses are the main diabetes care providers for the First Nations people. This therefore means that these two healthcare professionals need to work together and with other individuals to improve patient care. It would also be beneficial for a dietitian to be consulted, as type 2 diabetes can worsen from an unhealthy diet. A rural physician is important to include in this team, as many First Nations people live in rural settings and may find it difficult to travel to a bigger city to seek medical attention. For mental health, improvements in patient care would occur if a collaboration occurred between physicians, nurses, social workers, and a school or community-based mental health program coordinator. As most First Nations people seek medical attention from emergency department physicians and nurses, it is important for these healthcare professionals to be educated on this growing health concern. Also, most First Nations people who seek help for a mental illness are mostly children or adolescents. This would mean that support from a social worker would be important, but it is also vital that mental health program coordinators visit local schools to talk about mental illness and provide the students with information about their healthcare options. This leads us to the end of the presentation. Thank you for listening.